During the late 19th century, various treatments for alcoholism began to emerge, such as psychotherapy, hypnosis, electrotherapy, and hydrotherapy. However, most of these methods were not effective, and many alcoholic asylums were more like prisons than places of treatment. Therefore, organizations, crusades, or campaigns against the mass consumption of alcohol sprang up locally. Such was the Women's Christian Temperance Union, WCTU, founded in 1874 in the USA, in Cleveland, Ohio, by women who wanted to fight the problem of alcoholism in society. The WCTU was a national temperance organization in the United States that aimed to combat the use of alcohol and other drugs. It also supported women's right to vote, fought for children's rights, and fought for animal rights. The WCTU was a very influential movement, especially in the late 19th and early 20th centuries, when the organization attracted many women activists and expanded its activities throughout the country. Throughout its history, the WCTU has carried out many anti-alcohol campaigns, such as the plea for introduction of the prohibition and the struggle to limit the sale of alcohol. The WCTU today also continues its work in the U.S. and other countries of the world, fighting for the making of a better, healthier society. The organization also supports other initiatives aimed at protecting the rights of women, children, animal rights, and combating domestic violence. To summarize, in the 19th century, the problem of alcoholism was actively studied, but not yet fully understood, and there were no effective methods of treatment. However, the first steps towards studying and combating this serious problem have been made. In the 20th century, the problem of alcoholism remained pressing in many countries. In this regard, many governments and organizations have begun to actively deal with this problem. One of the first steps was to ban the production and sale of alcohol in the United States between 1920 and 1933, known as Prohibition. Prohibition in the United States was introduced to prohibit the production, sale, and consumption of alcoholic beverages in the country. It was introduced after years of campaigning by organizations and other social groups of the time to limit alcohol consumption in society. Prohibition was proclaimed during the presidency of Woodrow Wilson and became effective on January 16, 1920. However, the ban on alcohol did not have the expected effect and led to a number of negative consequences, including violation of the law, an increase in crime, and an increase in the production and distribution of clandestine alcohol. This was done by bootleggers, underground speculators who bought alcohol from underground producers and resold it to bars, where not only the golden youth of the city, but also ordinary workers secretly went to drink. One of the most famous bootleggers was the father of the future U.S. President, Joseph Kennedy. He brought huge quantities of alcoholic beverages from Canada and sold them through the mafia. Thus, while at the end of the 20s, alcohol consumption decreased by half and, accordingly, the number of patients with liver cirrhosis decreased by the same amount. In the early 30s, due to the widespread distribution of bootlegging, alcohol consumption exceeded the norm, which was before implementation of dry law. As a result, Prohibition was repealed in 1933, and the right to sell alcoholic beverages was returned to the states. It was also connected with the coming of power of the new president, Franklin Roosevelt, who immediately made amendments to the spending of free time by the population, and he also attributed allowing the sale of alcohol freely to the fact that it boosts the country's economy. Today, the use of alcohol in the United States is regulated by laws that apply to the state and federal levels. Each state has its own laws regarding the age at which a person can start drinking alcohol, as well as laws regarding the sale and consumption of alcohol in public places. After the repeal of Prohibition in the United States, new alcoholism treatment programs were created, such as Alcoholics Anonymous, founded in 1935 by Bill Wilson and Dr. Bob Smith. This program has become popular around the world and has helped many people cope with alcohol addiction. Founded by alcoholics for alcoholics, AA was established to help alcoholics overcome their illnesses and stay sober. Wilson himself suffered from alcoholism and was first introduced to the idea of starting a self-support group in 1935 when he was talking to a friend and realized that associating with other people who also suffered from alcoholism helped him fight the disease. This happened when drunkenly he met Abby Thatcher, who was an inveterate alcoholic. But at that time, Abby had not drunk for several weeks and felt great. He invited Wilson to the local church for meetings of people who suffer from alcohol addiction, but he refused. On the same day, Wilson was taken to the hospital with a concussion and a fever. After being discharged from the hospital, Bill no longer drank. That same year, Wilson founded the first AA group in Akron, Ohio, with fellow alcoholic Bob Smith. The principles of Alcoholics Anonymous are based on 12 steps, which are a combination of spiritual, ethical, and behavioral principles to help people overcome their addiction to alcohol. These steps, which include concepts such as admitting one's mistakes, forgiving and helping others, help people become more responsible and self-sufficient in their lives. AA became the basis for many other alcoholic asylums and treatment programs that were created in the following years. Today, Alcoholics Anonymous is one of the most widespread organizations that helps people fight alcohol addiction, and they exist in many countries around the world. Bill Wilson died in 1971, but his legacy lives on in helping many people fight alcohol addiction. The organization offers its services free of charge, and all its members are volunteers. In the middle of the 20th century, many scientific discoveries were made about the physiology and psychology of alcoholism, which led to the creation of new therapies such as Antabus, cognitive behavioral therapy, and others. Medical institutions and clinics specializing in the treatment of alcoholism were established. However, despite all efforts, alcohol addiction remains a serious problem in many countries today. New technologies, such as telemedicine and mobile applications for alcohol treatment, continue to emerge, and we can only hope that they will help fight this problem in the future. In the 20th century, many scientists and physicians went on to study the problem of alcoholism and develop new methods of treatment and prevention. For example, in 1956, disulfiram medication was generated, which caused an aversion to alcohol and was used to treat alcoholism. Currently, research on the problem of alcoholism continues, and scientists are working to develop more effective methods of treating and preventing this disease. In the early 2000s, in some countries such as Russia, Ukraine, and Belarus, alcohol consumption remained high, causing serious social problems such as violence, crime, unemployment, and premature death. In other countries, such as the US, UK, and Australia, the focus has been on education and informing people about the consequences of alcohol consumption. This included anti-drunk driving campaigns, warnings about the dangers of alcohol during pregnancy, and other measures. Alcoholism in the United States was and remains a serious problem. According to the National Institute on Alcohol Abuse and Alcoholism, about 14.5 million adults in the United States, about 5.8% of the population, suffer from alcohol addiction or abuse alcohol. The U.S. government and public organizations are actively fighting the problem of alcoholism. Various programs and tools have been created to help alcohol-addicted people, programs to manage alcohol addiction, and others. In the United States, there are many medical institutions and centers that specialize in the treatment of alcoholism and helping alcohol-addicted people. Among them are Betty Ford Center, Hazelden Betty Ford Foundation, Caron Treatment Centers, and many others. What is it that makes alcohol so appealing to its adherents? Ethyl alcohol, the main organic compound of any alcohol, has been used for medical purposes for centuries. For example, in ancient Egypt, it was used to disinfect wounds, and in ancient Greece, as an anesthesia before surgeries. During the Middle Ages in Europe, alcohol was often used to treat many ailments, including infections and pain. However, its use has not always been safe, and many patients may develop toxic reactions. To be continued in the next episode. Stay tuned.